Hi, I'm Dr. Eric Bunge, and we're going to be going over what is red light therapy, how to use it. We'll show you the new TheraLight bed and a class 4 laser, and we'll show you exactly what it does, how far each reaches. So red light therapy, though, it's sweeping the nation. And why is that? Because athletes have chronic inflammation, not just arthritis, but muscle soreness from performance, all the way down to arthritic joints forming, even some older ones, osteoporosis. Okay, so red light therapy offers promise for all these cases. Myself, in 5 years of clinical practice, I have seen it do incredible things. Just today, there was a significant groin sprain last Wednesday. She came in this Monday. No pain at all, no tenderness at all in that area. Seemed to be, she could stretch it. When I did resistive range of motion, didn't even bother her. Now, of course, she's been doing a red light bed for a few months, for about 6 weeks now. So her whole body is rejuvenated and able to absorb that injury much quicker. But like I said, it works fast, and it's very safe and gentle. Now, red light therapy or light therapy has been around since the Egyptians and the Greeks. They call it solar therapy. They found you could put sick people out in the sun and that you'd see a rejuvenation. But more importantly, in the 1990s, NASA was able to verify that certain specific wavelengths of red light therapy had a therapeutic value. That means that they actually improved healing. Now, important also is that they were totally safe. In other words, they did not cause a side effect. They did not cause cancer like UV rays. They did not have thermal heating like you'd see in infrared therapies. But they did have this incredible potential to help someone heal quicker, better, without any side effects. So since then, and like right now, we see a tremendous wave of small devices, bigger devices, the Juvie, the TheraLight, the Aspen lasers, a whole slew of other laser products are out there. But let's just talk about how each of these specifically works. So we know that the sun has a full rainbow spectrum of light coming out of it. And then there's a lot of stuff you can't see. Of course, we have everything from X-rays, which get diminished in the atmosphere, to UV radiation, which makes it through that we don't want. But right here, we see the spectrum of light that we can. For instance, it's blue, okay, and red. Now, they're measured in what's called nanometers. So blue is a 475, and the reason I bring that up is because research has shown that that's been very good at helping skin conditions. But we're going to focus on red, which is 635, and near red, which is about 850 and 950. You can't really see these two, but they're really close to red, and they act the same way in healing. So the sun, we know, is putting out these specific wavelengths of light. We know if we can isolate them, and that's what these products do. If you buy a red light therapy, it's not just a red light bulb. It's probably a 635 nanometer red light diode, or 635 and an 850 like the Juvie. Very good. Put the two together, get even better results. The difference between some lights is that one's a diode and one's a laser. And of course, with the laser, we're going to have light streaming all parallel. It's very covalent. And a lot of laser, it's able to reach very, very deep because it has no scatter. A diode, just like a light bulb, right from the beginning, starts scattering. So like a Juvie, we got a wall, the wall hits us. And a TheraLight, we have a tube, we get in the tube, everything's aimed at the middle. That way the scatter is minimized and we get more absorption in our skin and in the deeper tissues. But why do we get results? But like I said, they each reach a certain length into us. 635, we're going to see most of our benefit in the skin. You're going to see healing. You'll just read the reviews. It does work, including balding. Now it's going to reverse balding, but it'll certainly make hair grow better. Fascia, muscle pains, aches and pains, that kind of stuff. You'll see that happening. Muscle repair following an injury. Or more importantly, if you're an athlete that's got incredible performance, if you're out there working out, you've got what's called oxidative stress happening. And the quicker you get it out of the cell, the faster you're going to be recovered. And this does it. It gets deep into the muscles when you start getting powerful enough in the higher wavelengths. And of course, the 950 is able to reach the deepest. So where's the data on what does work? If you look, there's been, I think, over 30,000 research projects been done. But if you just go to PubMed and put in LLLT, which is low-level light therapy, you'll see all the different research that's been done that shows that ligaments actually get better. that we see nerves healing faster. Dentists are using it with bones, athletes with tendon, manual therapists with fascia, any kind of skin anesthetist skin. These red light specific wavelengths do have a positive effect. And what is that? Like I said, NASA has found out, and all the research has shown, that these photons of energy, that little, what's inside a beam of light, go into what's called a cell mitochondria. And anybody that's an athlete, you know that energy comes from the mitochondria in the cell, and you're trying to get as much nutrition in there. Even if you're on a keto diet, ATP has to be created because it's the fuel of life. Everything runs on these little ATP. Now in the mitochondria, within a cell, most of us don't realize what's in there, but the mitochondria is what makes this ATP, and then the nucleus and the Golgi bodies and the endoplasmic reticulum, they're what take that energy and create proteins and enzymes. Endoplasmic reticulum creates lipid structures for the cell wall. They all need this ATP to make it happen. And most of us have either high exercise loads, or we're not able to move around as much, and so we get this stagnation going inside the cell, and that's called oxidative stress. And that oxidative stress keeps building up. Maybe the next time you replicate something, you have a free radical damage happening. All kinds of problems are coming from this oxidative stress that's building up inside the cell. What we know is that nitric oxide is binding to the ATP, and in the mitochondria, the ATP, once it's ATP, it comes out, it gets used, it comes back as ATP. So it's very efficient, it's a cycle, right? Well, this nitric oxide, because of the stagnation, attaches to the ATP and what's called the electron transport train in the mitochondria, blocking it all or slowing down the progress. The best we have of why it works and why it's so safe doesn't affect anything else in here except for the mitochondria. It allows that nitric oxide to get off. ATP then pops out of the mitochondria. The body starts using that right away to heal whatever kind of cell it is. The only question is it covalent enough to reach? Is it powerful enough to do any good? And is it at the specific wavelengths? This whole process of creating ATP is called cell respiration, and it includes what's one of the first things that's going to happen when the ATP is released? We're going to get rid of all those free radical species. They're going to be exiting the cell. We're going to have a much cleaner cell. And the neat thing is nitric oxide in your vascular system actually creates healing, opening up vascular beds. It's one of the reasons we see this accelerated healing happening. Red light creates rejuvenation through cell respiration. We know how it happens, and it affects everything in a positive way. My own case histories from dropped foot and sciatica, of course, all kinds of muscle pain, torn ligaments. Definitely in a couple weeks you see a tremendous improvement. Everyone's fascia and skin, they just feel better, they're moving better. I can take a second here, we'll show you the TheraLight bed and the laser and get you out of here. So red light therapy, of course, has bigger top of the line units, and this is a TheraLight 360 brand new model. This is actually number 28. Enables you to get full surround effect head to toe. If you turn it on, now you can only see the 635. You notice the other ones look like they're not on? That's because they're these higher wavelengths and they're penetrating deep. These are getting through muscle. This is going down all the way to the ligaments and tendons, and of course 635 is staying on top, providing all the benefits that you've heard about. So this is a 980 nanometer, 15 watt class 4 laser. It has a 635 nanometer aiming laser. When we actually turn the full power on, you can't tell the difference. It's really something you can't see, but it is able to penetrate. And what I mean by that is, imagine the ability of this red light therapy without any side effects. It doesn't make it weaker like steroids do. It doesn't have to poke through the holes through the skin and create inflammation or rough it up. It allows penetrating cell respiration action to happen all the way down to the multifidi, through the spina rectis, the QL, the skin, some superficial fascia, all the joints, the neck. Imagine all those little muscles underneath the head here in the neck. Everyone, people love this. If you've got a headache or TMJD or neck pain, you will simply love the way this feels. just for a few minutes, 5 minutes sitting in a chair, I can do the whole neck because it's so strong and get all those great results. If I'm doing some Graston work or some fascia work, some cleaning out, not only can I use this to warm things up, but I can use this afterwards if they're feeling a little discomfort, because as you know, when you start releasing fascia, all of a sudden you quit feeling the pain here and you have some hidden spots and you're like, wow, can you get that for me, doc? Yep. Deep into the shoulder, all that rotator cuff parts. So red light therapy has to be strong enough, it has to be the right frequencies, and whoever's driving the light should really know what they're doing, not only just as far as how to treat pain, but all the anatomy that you're affecting. There are a couple things that you do want to protect: the thyroid, the carotid sinus, outside genital parts, and of course the eyes. Any skin cancer, well, we want to cover that up. But other than that, for 5 years we've been using it. We have great results. And if you're going to buy a unit, you want to come in and test ours for a couple of weeks, you'll get to see immediately how it feels. And if you are out shopping, Juvie has a nice unit. Aspen Lasers, there's a couple other laser companies out there, but you want to make sure you get a strong enough one. And of course now, the world of red light therapy has been revolutionized by the new TheraLight bed, and do enjoy how that feels. So if you have aches and pains and you're looking for a safe alternative, if you're into sports or some kind of elite competition and you want performance gains like nothing else will do, choose red light therapy, cell respiration. Get rid of that oxidative stress right at the cause, clean yourself out, see how things get stronger and feel better. You will not be disappointed. Hope you enjoyed, and if you have any questions, we'll try to answer them. Thank you.